Hello, people of YouTube. Welcome to my second video in my series about my ulnar shortening osteotomy surgery. So the second video, I'm going to be talking about the different surgical options that my surgeon and I talked about. Like I said in my last video, if you don't know what I'm talking about, I'm Hallie. And my first video was about my history of my wrist pain, how I got to be in the situation, why I needed to be getting surgery in the first place, and briefly talked about my surgeon and all of that. So this video is just talking about the different surgical options and the different options that, I guess also non-surgical, that I discussed with him, he discussed with me, and how he got to the decision of to do a ulnar shortening osteotomy or osteotomy, however you want to say it. So that's going to be this video, and then I will post another video before pre-op because I just want to talk about my pain. My pain has actually changed since my last video. It has become more and different sites of pain and different pain symptoms. So I kind of want to talk about that just so that if any of you are watching this or any of you in the future are watching this and are getting the surgery and have different pain or more pain, that you don't feel weird or odd or anything. So the plan is, this is my second video. We're going to talk about surgery options, yay, kind of. And then I'm going to do a third video talking about my pain and how I'm preparing for surgery and for surgery recovery. And then I will do a pre-op video and then a surgery video, and then we'll do check-ins periodically after that. So let's get rolling. So I am 8 days out from surgery. My surgery is next Friday, and today is a Wednesday, so yeah, I guess 9 days. And yeah. So when I went to see my surgeon, I guess I kind of expressed in my last video, as I said in my last video, I have been in low-level pain with some ups and downs and symptoms for years, at least 3, if not 6. And so I went to see him, and he was like, okay, yeah, you probably have what is called ulnar impaction syndrome, which is where your ulna is longer than your radius. And again, your ulna being this bone. I have a lot of anatomy, a lot of pictures up on that first video. So feel free to watch that if you need some reference points. But in ulnar impaction syndrome, you can also have some other issues where like your TFCC, your triangular fibrocartilage complex, is torn. Other cartilage, whether it's ligaments or tendons in that joint space, can be torn, things like that. So it's like, yes, you have that. Our one option can be a cortisone injection, which I didn't want because I've already had multiple in this wrist. I believe I'm at 5 in just my right wrist, and that's a lot. So I didn't want that. And then he also said, well, we can send you home with a brace. Well, I already have a brace. I'm wearing it now. I got this one off of Amazon, and I linked it I didn't link it. I posted it on my story on my Instagram, which I'll put my Instagram handle below if you guys want to follow, because I will be posting like more updates, more like smaller things on Instagram. So feel free to follow along there. And I have a story highlight, don't know what that was. A story highlight talking about this surgery and updates for it. So I already have a brace, so I said, okay, that's already taken care of. And he goes, okay, so surgical options. And what that came down to is there's really 3. And what I'm going to do now is I'm going to try to remember the best that I can what my surgeon said to me. But I also found a really amazing website called physiopedia.com, which I have pulled up behind me, that's what I keep looking at, that explains it also. And I will put this URL below as well, so you guys can reference it as well. I am all for doing your own research and knowing what you're getting into. So the first kind of surgical option that my surgeon and I talked about is they go in arthroscopically, and they go in through the side, on the ulnar side here near the ulnar head, and they basically just like shave. They just shave it down, and perfectly fine. However, my surgeon, one, did not like that option because it can leave a lot of residual scar tissue in the joint space, And just about a year and a half ago, I had ankle surgery to remove scar tissue from my ankle because it was causing me a lot of pain and a lot of struggles. So I didn't really want to have any scar tissue. And also, here comes my rant, also my surgeon told me that he is not very good at that procedure. But he looked at me and he said, but if that is a route you want to go, shop around, find a doctor who is good at that, who likes doing that procedure, and go for it. And so here's my spiel. You are the champion of your own health. And while that can be really scary when you're sitting there talking to a surgeon who obviously did a lot of school to know what they know, or when you're sitting there in a room and you get told that they're going to cut your arm in half, like, it can be really scary to go to doctor's offices by yourself and hear the things that they're going to do and learn about your body. It can be a lot and it can be really hard, but you are the champion of your own health. And you have to be able to look at your surgeon and say, I don't like this care plan, we need to change it. Or I don't feel comfortable with that diagnosis. Is there another test we can run? Or is there someone else I can go see? And if your doctor isn't comfortable with you going to see someone else, go see someone else. If your doctor doesn't ask your opinion about a care plan, if your doctor doesn't ask your opinion about anything, go see someone else, because it's your body, it's your life, it's your health. You're going to have to deal with the ramifications of it. So if you sign a waiver saying, yes, I'm fine with this, and then you're not fine with it, they don't know that, okay? And again, it can be really scary, it can be very hard, but you're allowed to shop around. You're allowed to shop around doctors. You're allowed to shop around surgeons. You're allowed. And I believe they, depending on the doctor's office you go to, but they have, I don't remember what the word is for it now, but they have like a health chaperone, basically, who you can sign a form and ask them to go into your doctor's appointments with you, so that if you don't feel comfortable asking questions of a doctor because they know more than you or whatever, there is something like that available. So you can look into that. I don't fully remember what that's called. I'll look it up and I can put it in the little description below. But so make sure that you're comfortable with anything your doctor says and does. If I was set on having that arthroscopically done and that was this procedure I wanted, and he told me he wasn't very good at it, that's fine. I can go somewhere else. The other thing is, I appreciated him telling me that he wasn't very good at it. Because the thing is that, I mean, I'm not good at everything, right? You're not good at everything. We are, as humans, are not good at every single thing that we do. And so him as a surgeon, he's a hand and wrist specialist, but he's studied certain things. He's done certain procedures. And so I appreciated him giving me that feedback. But so that's why we kind of ruled out that option. The second option is something called an arthroscopic wafer procedure. And this is where, again, what I believe is they go in kind of in the middle of your wrist here. They go in right here. And they basically like chip off a little piece of your ulnar head, like this piece. So you're almost shaped kind of like this. And they go in and they chip this off. And there are certain reasons why this is or isn't good. Was what Physiopedia says. But again, my doctor and I talked about that, and he said that with that procedure, there is a very high increased risk to have arthritis within 5 years. Now, I'm 25 years old. I don't want arthritis in my hand when I'm 30. Now, if I was a little older, or if I already had some arthritis issues or things like that, then maybe. But I don't want that. And the other thing that he discussed with me is that it also changes the way that your ulna and your radius work together, right? So the way that they articulate, which is what the proper word is, together is based on their shape and their structure and their form, right? And so he says that taking off that chip, while it might help with the impaction because there's more space in there, it may also change the way the ulna and the radius interact, and the way the ulna and some of the carpal bones interact. And so it might not give me the quality of life, the range of motion, the accessibility that I want. Because again, I'm 25. I've been active my whole life. I want to get back into lifting weights and playing sports and doing things. So that was kind of why we ruled out that option. And then that leaves the ulnar shortening osteotomy. And this, which I don't remember how much I talked about this in the last video, but what they do for this is they go in arthroscopically first. So I'll have two little incisions right here and here, I believe, maybe a little lower. And they will check out the joint space. They will see if the TFCC needs to be debridement, whatever. They'll see if that needs to be removed. They'll look at how far the ulna really is above the radius. They'll just check everything else out. Because while they have imaging, they have x-rays, they have MRIs of my wrist, seeing it in person, seeing what's actually there is always more reliable. And I mean, my x-ray is from November when I went to see him, this surgeon, the first time. But my MRI is from 2 years ago, maybe 3. So it's not very reliable. Yes, I mean, all the things are still there, but again, I have a bone cyst now. Things could have moved, things could have shifted, who knows? So having them be able to see it is really what they want. So they'll go in, they'll look at that, and then if the diagnosis is double, triple confirmed, if it's confirmed, then they will go in to do the ulnar shortening. So what they do for that is they make an incision down your arm, I believe right here. I'm not exactly sure how long it is, but I believe it's kind of closer to the head, not to the elbow. But I believe right in here, they make an incision down this way, and they cut the bone. And they do this in a stepwise fashion. I'm gonna see if I can find a picture to add. So what they'll do is they'll go in like at the more distal side, and they'll go from the outside, and they'll cut a little piece, not all the way through the bone, but they'll cut like a half to 2/3 the way through. And then further down here, on the radial side, on I guess the medial side, they'll do another cut halfway, 2/3 the way through, and they'll connect those cuts. So it's like it's a step. And then from the inside, that's where they'll cut out the amount that they need to. And again, for me, he told me 3 millimeters. That might change. I'm not sure if they do half and half on each side or 1/3 and they can't do 1/3 math, but I'm not sure how they do that. If they take it all from one side or half, and then they pull the pieces together, they put in, and I'll find a picture of the hardware. They put in the hardware, which is the metal. It is a plate and screws, and one screw goes diagonally through those 2 cuts. And that's the stepwise cut. That's the one that they use most nowadays. That's the one that most of the surgeries or most of the research says is the most effective. And so yeah, so those were the options we talked about. The ulnar shortening, the osteotomy, is the longest recovery time because your bone has to heal. Whereas the wafer resection, I believe, was the second longest, and then the fully arthroscopic was the shortest recovery time. But again, it was those other things we talked about. I didn't want scar tissue built up in there. I didn't want to have arthritis in 5 years. And again, it's not 100% chance you're going to have arthritis. I don't remember what he told me the statistic was, but it was a higher chance within 5 years. And I didn't want that. And so that's why we decided to go with the osteotomy. And again, just because this was the right decision for me, it might not be the right decision for you. If you're watching this and you know you're having ulnar-sided wrist pain and you're going to go talk to a surgeon, don't automatically say, oh well, I don't want scar tissue and I don't want arthritis in 5 years, so I want this. Right? Talk to them about your options. Your surgeon is going to be different than my surgeon. Even if the exact same surgeon, it's going to be a different time, and you're completely different than I am. So talk to your surgeon about your specific case and what you both feel is the best for you. Again, remember, you are the champion of your health. It can't just be your surgeon telling you what's best, because they don't have to live your life afterwards. You do. There is it's between like 42 and 47% of those who get the ulnar shortening osteotomies that don't like the hardware. They can't deal with it. It feels weird. It clicks. It hinges. It does messes up. They don't like it, and so they get it taken out. I have read in research though that when people have gotten taken it out, they're at higher risk of fracture in that site. Again, another thing to think about. If you don't want to have just more details to have. I'm hoping that the hardware feels fine and that I don't have to worry about getting it taken out because that's a second surgery. But we will deal with that when we deal with that. And I'll keep you guys updated. Those were the 3 different surgical options that we talked about. And hopefully that helps you have a better idea of what I'm getting done and what in the future, again, maybe you'll need to be getting done, and just different options. So I will post this soon, and then I'm going to do my 3rd video just talking about my pain and how I'm preparing for surgery and surgery recovery. I'll try to post that also this week because next week is going to be very busy. And then Monday is my pre-op appointment, and I will be asking my doctor lots of questions. Hopefully I'll get a new x-ray, and yes, but I'll fill you guys in on that on Monday or Tuesday. And then next Friday is surgery. So be looking for those updates for all of those fun things. Feel free to follow my Instagram because I will be posting more updates there and like shorter updates. And yeah, have a great day.